The new White House coronavirus task force is putting our state again in the red zone. This news comes as St. Francis Health System is reporting a record number of COVID-19 patients last week. 2 Works for You's Brady Halbleib has more new information for us on the hospital's call to action. Brady.
Yeah, well, local leaders say this underscores the urgency to simply follow COVID safety guidelines, and many health experts are fearing the worst of the pandemic has yet to happen in Green Country.
We are headed in the wrong direction.
St. Francis Hospital CEO Jake Henry says the current COVID-19 hospitalization rate is not sustainable. The latest White House coronavirus task force report reinforcing the message to take the virus seriously.
Wear a mask, wash your hands, watch your distance.
This is the coronavirus task force report, an 11-page document identifying counties across the state seeing a spike in cases.
If we're going to prevent the spread of this virus, it's time to get serious about prevention efforts.
According to the report, Oklahoma now the 8th highest rate in the nation for COVID test positivity. There were at least 101 more cases per 100,000 within the last week. That puts Oklahoma's positivity rate at or above 10.1%. Oklahoma, Cleveland, and Tulsa counties reporting the highest number of new cases over the past 3 weeks. Those counties also account for nearly 40% of the total number of cases throughout the state.
I think we have to reframe our conversations from do we have hospital capacity to how can we prevent this virus is spreading.
The Tulsa City County Health Department's COVID-19 heat map shows how the virus spreads throughout the county over time. It moves and migrates week to week. A drop the week of October 4th, but then right back where it was October 18th. These maps on par with the White House report. In addition, 84% of all counties in the state have a moderate or high levels of community transition. More than half of the counties are in the red zone. Many people think transmission only happens within metro areas, but that is not true. In fact, city officials recently announced the majority of patients hospitalized with COVID-19 live outside of Tulsa city limits. Many of those patients from rural towns and cities without a mask mandate. Brady Halbleib, 2 Works for You.